I think we will be the leader in the healthcare across globe. So that is the future of India, wherein everything gets integrated. With that, all the facility or the government policies will be, become easier. You will be able to know that which area, which region has got a which particular disease coming up or cropping up. So you can mobilize your infrastructure according.
So now let's just shift gears for a moment. And my next question is that, as there are the most promising innovations and technology enhancements that you have witnessed in recent times, I would like to ask about them. And what's your perspective on how future of healthcare would look like in India?
Okay, in India. So my answer will be influenced with the National Health Authority's initiative, the National Digital Health Mission. And I was fortunate, and I was director project management out there. So I know the complete project, and that is, I wish also as a, now I am an outsider. So I wish that project gets take off and get implemented across India. And earlier, one of the similar call from the Singapore healthcare management of people, I shared that thing, and they were surprised. Even some of the Indians panelists were there, and they were surprised that this type of initiative is being taken care of by the Indian government. And if India is thinking this way, they are way ahead from the global leaders in the healthcare. So before answering to that, let me explain you the digital, the NDHM project, how it was conceived. So the concept was that National Health Authority is integrating across India every healthcare facility, be it hospital, laboratory, pharmacy, medical devices, everything they are integrating, and it is in a distributed environment. When I say integrating, is there is a provision that they have created an infrastructure or the system out there where every doctor or the health professional need to get registered into the health professional registry.
Yes.
So with that, that will become a single source of truth across the India with the National Health Authority, that this particular doctor, if in your locality, if you see that I want to meet some orthopedician. So today it is like a Swiggy that if you want to have a pizza, you have got a choice that this store, that store, you can choose this type of pizza you can order. And not only you order for yourself, you can order for your friends, relatives also across I would say globe, wherever these applications are working. So similarly, this was conceived that all the hospital doctors, and not only the doctors, from the WHO's guidelines, we extended this to the all healthcare professionals. So all healthcare professionals are registered into HPR. Then in the HFR, Health Facility Registry, all the facilities has to get registered to be the part of the NDHM. And all the citizen of India has to have a health ID with the National Health Authority, which will get...
Like in America, they have a healthcare ID. And
yes, I will not comment here. That will go into a different direction because I have studied the American healthcare system also. So just for your information, we studied the America, Canada, UK, Singapore, Australia system to develop this NDHM system. So we know all the deficiencies sitting in their system and what we did it. So the most important aspect which Indian government has adopted was the voluntary participation of the patient, so-called citizen, and the facility provider. You are not forced like other countries that you have to be in the this particular project or process. If you want to avail the healthcare services, you want to be part of it, you get registered and then you will be there. The beauty of it is that there is an application have been developed that if you go to, for example, Tata Memorial Hospital in Bombay, and then you come to the AIMS Delhi, and then you go to, for example, Medanta at the end of the day, or you are coming to Gangaram Hospital. And during this course of action, you got tested into Metropolis or OnQuest or Lal's Path Lab or some XYZ lab laboratory, and you availed the services of some pharmacies across these respective cities and hospitals. All this data, or be it imaging or radiology or pathology, whatever you have done, everything will be sitting in your mobile. Every data will be sitting in your mobile, right? And if you're coming to the doctor is, if the doctor and the facility is registered into the NDHM, they will be able to ask you that whether you are registered. If you are registered, then they will ask permission from you. Based upon your permission, if you want to share that, you would like to share only one particular hospital's information with them, so you need to tick those boxes, and a duration. I would say that, if I am talking, I want to share this data for next 30 minutes or 1 hour. So you have that particular option also sitting there, or perpetual. So based upon patient's consent, that particular information will be shoot to the NHA server. NHA will shoot a OTP based upon that. That OTP will get shared to the facility or the hospital. And then this hospital will be able to get the data from the respective hospitals. Suppose if you are sitting in the Gangaram and you are giving a permission to for the records of Tata Memorial and the Metropolis reports. So those reports, the system will fetch the reports from there and will display on your monitor. You need not to carry the whole files, etc. So this is how your whole data, country's data, can be portable from one facility to another facility. So this is integrating a healthcare system. So if this is implemented in a effective and efficient way, it is up to the government of India to make people knowledgeable about this particular project. And then if this is implemented across India perfectly, I think we will be the leader in the healthcare across globe. So that is the future of India, wherein everything gets integrated. With that, all the facility or the government policies will be become easier. You will be able to know that which area, which region has got which particular disease coming up or cropping up. So you can mobilize your infrastructure accordingly. You can optimize your pharmacy. You can optimize your resources. You can optimize your clinicians. Your hospital in the remote areas will not be depriving of the medical facilities. You have, I think, if I'm not wrong, we have 1 lakh bed across India, including private and government hospitals. And contrary to that, we have one clinician on somewhere around 2000 bed, one clinician. So those things will not be there once this type of systems get implemented. So clinical deficiency or the resource deficiency across India will not be there. You will be able to optimize clinicians. One clinician is overoccupied. On the contrary, the another clinician is freely sitting out there waiting for the patient. Similarly, your businesses, one business is overpopulated, not able to serve the population. The another business is not getting the enough business out to do the serve. So those type of things will get. I would say that there will be an equilibrium across the business of the healthcare ecosystem, and government will have a better visibility of the healthcare data to create the national policy and improve it.
Yes, indeed, this all sounds very promising for the citizens of the country, and the future of healthcare clearly looks really bright. So